Hi, my name is Grace Marquez. I'm going to speak about Chikungunya virus. Definition: Chikungunya is a viral disease transmitted by Aedes mosquito to humans. The word chikungunya means that she's been at, and allusions to the departure of the suffering patients. The most common clinical for associations fevers, arthralgia, and rash. The next items. Symptoms. Most people influenced with chikungunya virus will develop some symptoms. Symptoms usually begin 3 to 7 days after an infested mosquito bites you. The most common symptoms are fever and joint pains. Other symptoms may include headache, muscle pains, joints, swellings, or rash. The next video is
Mosquitoes can transmit a number of human diseases. Malaria is perhaps the most well known, but other diseases such as dengue fever, yellow fever, and West Nile encephalomyelitis can infect many people each year. Chikungunya is a mosquito-borne disease caused by a virus that was first described in Tanzania in 1952. It's now been seen in over 100 countries on 5 continents. Chikungunya outbreaks have become more common in the past 10 years, some of which have infected over 1 million people. While we're still learning a great deal about the virus and the disease, it appears that the recent increase is a result of changes in both the virus and in the mosquitoes that transmit it. People become infected by chikungunya virus after being bitten by an infected mosquito. The virus replicates in the person, who then infects subsequent mosquitoes when they're fed upon, completing the virus life cycle. People usually become sick within a week or two after being bitten by an infected mosquito. Over 3/4 of infected people will usually develop symptoms, which appear suddenly and include fever, a characteristic rash, digestive problems, and joint pain. The joint pain and stiffness can potentially last for months to years. Rarely, people may develop neurological symptoms.
application in medicines. The virus is rarely fatal, but the symptoms can be severe and basic volumes. Most patients recover from the fevers, windings, and with. But the joint pain have been now to persist for months. There are now specific drugs to treat chikungunya. Doctors simples recommend receipts and plenty of fluids. The next items: medication. Over the counter medication will help easy fevers and joint pains. These include naproxen, ibuprofen, acetaminophen. The next video is
Just like malaria and dengue, chikungunya is also a viral fever disease which is transmitted to humans by the bite of infected mosquitoes, that is Aedes aegypti and Aedes albopictus. There are several methods which can be used for the diagnosis, but the most standard serological test is ELISA, that is enzyme-linked immunosorbent assay. The main purpose of this test is to detect or to confirm the presence of antibodies which are secreted in your body against this chikungunya virus. And the level of these antibodies will rise within 3 to 5 weeks with the onset of illness, and it almost persists for almost 2 months. If you are experiencing symptoms like sudden onset of fever with joint pains, and then other symptoms like body pain, muscle cramps, headache, nausea, I recommend you to take this test. During monsoon season, chikungunya is very common as mosquito tends to breed and get infected with this virus.
Pros and cons. Pros. Fever that lasts a few days. Over-the-counter medication will help ease fevers and joint pains. It is not considered contagious. Cause joint pains that can last weeks or months. There are no specific drugs, simple recommend rest and plenty of fluids. There is now vaccine or antiviral trends. The next video is
Since 2005, chikungunya outbreaks have been increasing in severity. Scientists have found that the virus has been evolving to more easily infect Aedes albopictus mosquitoes. As albopictus is spread across the globe, so has chikungunya evolved to be better transmitted by albopictus. Scientists are concerned that this evolution of chikungunya could mean a higher risk of disease outbreaks as albopictus continues to establish in new areas and the virus becomes better suited to use this mosquito as its vector. There is no treatment currently available for chikungunya. No effective drugs or vaccines exist, but there are many areas of active research looking for ways to treat, control, and stop this virus. Control of the disease is limited to control of the mosquito vectors and avoidance of mosquito bites by people. There are many avenues of research underway to control this virus, ranging from the development of a vaccine to release of genetically modified mosquitoes. The latter, which kind of sounds fanciful, can be used to decrease mosquito populations or spread traits through the mosquito population that makes them less effective at transmitting. This has the direct benefit of limiting chikungunya, but might also be helpful at reducing other mosquito-borne diseases.
issue playing in Ecuador. This virus was detected for the first time in 2014 and its transmission happens in many tropical and subtropical. Some air existence the presence of the mosquitoes. 2015 was the year with the most cases. Drastical decrease is cases between 2016 and 2017. Until 2018, now cases have been reported. Conclusions. If you now you have chikungunya, avoid get four mosquitoes bite during the first week of illness. Virus may transmit the virus to nude mosquitoes. You may in turns infect other people. Pacing precautions. Pacing precautions should be twins, be people traveling to risk areas and this including use of repellents, wearing glove, sleep and pains, ensuring rows or fittings with and risk to prevent mosquitoes from entering. Thank you.